Good morning, everyone. So I'm here to present my paper on the topic Prevalence of Dry Eye Disease in Polycystic Ovary Syndrome, an observational study. We have no financial support or sponsorship and no conflict of interest. So dry eye disease, as we all know, is one of the most common problems affecting the general population and can be quite debilitating. Women are disproportionately affected with more severe symptoms. And polycystic ovary syndrome is one of the most common endocrine abnormalities in women of reproductive age group and is well known to have consequences extending far beyond the reproductive system. Androgen receptors have been identified in meibomian glands, and it is likely that meibomian gland function is regulated by androgens. However, the link between PCOS and the ocular surface has been under investigated. The aim of our study is to evaluate the prevalence and type of dry eyes among patients of polycystic ovary syndrome. This is a hospital-based observational case control study. The study population includes 33 recently diagnosed cases of polycystic ovary syndrome getting treatment at the outpatient and inpatient departments of obstetrics and gynec department, the medicine department and endocrinology department of our hospital, and 28 age-matched controls picked randomly from the patients attending the ophthalmology OPD. The right eye of all subjects was examined. The study was conducted in accordance with the principles outlined in Declaration of Helsinki, and a written informed consent was obtained from all patients and healthy volunteers. So, as I mentioned earlier, inclusion criteria included women in reproductive age group with a recent diagnosis of PCOS, and patients who have been received hormonal therapy for infertility or used oral contraceptive drugs in the past 6 months have been excluded from the study. Also excluded were patients having other systemic conditions affecting the ocular surface, like Stevens-Johnson syndrome, patients using drugs affecting the ocular surface, patients with history of ocular surface surgery, contact lens users, and patients with prolonged screen time have been excluded from the study. The ophthalmic evaluations for dry eye was done with emphasis on tear film breakup time. The Schaumer test run without the anesthesia, and the ocular surface disease index score was calculated. Statistical analysis was done using SPSS software, and a p-value of less than 0.05 was considered statistically significant. Coming to the results, in the TBUT, in the study group was the mean TBUT was 8.57 with a standard deviation of 3.07 second, while in the control group it was found to be 11.82 with a standard deviation of 2.21 seconds, and these results are in accordance with some of the previous studies done in this area. In the Schaumer test, the study group, the mean was found to be 12.84 with a standard deviation of 7.90 millimeters, while in the control group, the mean was found to be 27.28 with a 6.31 millimeters of standard deviation. Our results differ from the previous studies, which have found a normal Schaumer test values in the PCOS group. In the OSTI questionnaire, the study group average was OSTI score was 14.66 with a standard deviation of 5.74, while in the control group it was 7.89 with a standard deviation of 3.33. And our results are in accordance with the previous study done by Gonen et al. Now, as I mentioned in my results, coming to the discussion, this is a comparison of our study with previous studies in this done in this area. And as I mentioned, in the Schaumer test, we found a significant decrease in the Schaumer test results in our PCOS group, while in the previous studies they have found almost a normal Schaumer test in both the PCOS and the control groups, while our TBOT and OSTI results tally with are in accordance with all the previous studies done in this area. Now, our results show a significant decrease in the Schaumer and TBUT values in the PCOS group, while an increase in the OSTI scores has been observed in the PCOS group. Androgens, as we all know, regulate the meibomian and lacrimal gland functions and contribute to tear production. In PCOS, the main hormonal change that causes clinical signs and symptoms is hyperandrogenism, as a result of which there may be insensitivity or downregulation in the androgen receptors, which may be a factor leading to reduced tear production. So our results are suggestive of a positive correlation between dry eyes and PCOS, and the type of dry eye that we see is a mixed type, that is both evaporative and aqueous deficient type. Our data concerning ocular changes in patients with PCOS are quite limited, and dry eye is often overlooked in the context of PCOS. So our take-home message would be, we suggest all patients of PCOS should be screened for dry eyes, and further research in this area is required for a more targeted approach in treating dry eye disease in women. These are my references. Thank you.
Did you do any analysis of the job profile of all the women groups that you studied?
No, ma'am, we haven't done an analysis on the job profile.
Just PCOS and non-PCOS?
Just PCOS and healthy. No, not the job profile. Just we have excluded people with having prolonged screen time, exposed to prolonged screen time.